Good day, everyone. Let's start with our discussion. First, with the assessment of the skull and face. So, assessment of the skull and face. First, inspect the skull for shape and symmetry. Inspect the facial features of the patient. And inspect eyes for edema and hollowness. So, of course, the scape of the skull should be symmetric. No, even the facial features. Of course, you should have two eyebrows, two eyes. No, the nose should have two nostrils, and even the lips or the mouth should be symmetric. For the eyes, you have to check for edema. Edema meaning swelling around the eyes. No, if there is swelling around the eyes, it can mean several diseases. Okay, such as kidney injuries. For hollowness, meaning is the eyes deep in the orbit. No? So if you have hollow eyes, it can mean dehydration. Okay, so because in dehydrated patients, the eyes goes deep down the orbit. Okay, it burrows behind the orbit. Okay. Next is inspect facial symmetry and movements. So ask the patient to elevate the eyebrows, frown or lower the eyebrows, and close eyes tightly. So paano mo yung gagawin? Sasabihan mo lang sa patient, Ma'am or sir, pakitaas ang kilay. So tataas niya yung kilay niya. So dapat pantay yun, no? So ask also the patient to frown, simangot. Ma'am, sir, simangot po kayo. So dapat may pagsimangot yung eyebrows ng patient. That will check muscle movement of the forehead. Okay? And then ask the patient to close eyes tightly. Pikit ng mahigpit. Okay? So that also assesses the muscles around the eyelids. Okay? Then ask the patient to puff cheeks. So paano yon? Sabihan mo na lang sa patient na, Ma'am, sir, gayahin mo ako kasi medyo mahirap i-instruct yung puff cheeks sa Tagalog, no? So, paano mo siya gagawin? Parang ganito, no? Okay. So, that assesses muscles of the mouth, okay, and the cheeks. So, ask the patient to smile. Walang teeth muna, and then show teeth. So, after smiling, show teeth. Okay, so that assesses again muscles of the face, of the cheeks, and of the mouth. Okay, so all of them, they should be symmetric, all those movements. So recap, ask the patient to elevate eyebrows, frown or simangot, close eyes tightly, puff cheeks, smile, and then show teeth. Okay, so palpate the skull for nodules, mosses, or depression. Include the fontanelles for pediatric patients. Later, we will talk more about fontanelles. Okay. So let's review anatomy of the skull and face. This is your skull. Okay. So we have the biggest bone in front of your skull, which is your frontal bone. Okay. This is your nasal bone, the bones around your nose, specifically at the top of the nose, because 2/3 of the nose in this area, those are cartilages already. Okay, so this is your zygomatic bone around the cheeks, and this is your mental foramen of the mandible. So this is the mandibular bone. Okay, the bone of your jaw. Okay, so we have different foramens there, meaning opening or holes of the bones wherein nerves enter and exit. Okay. So again, frontal bone, nasal bone, zygomatic bone, and maxillary part of the zygomatic bone, and this is your mandible. So behind the eyes, you have your excuse me, you have your orbital bone, okay, and the sphenoid bone. So here, again, this is the frontal bone in front of the skull. This is your zygomatic bone. This is your maxillary part of the zygomatic bone. Okay, nasal bone. A small bone behind the maxilla, medially to that, directly posterior is your lacrimal. This is your mandible, again the jaw. Okay. So for the skull, aside from the frontal bone, you also have your parietal bone. And the most posterior bone is your occipital bone. Lateral bones are your temporal. Okay. Here, so frontal bone, parietal, temporal. Okay. Zygomatic, maxillary, mandibular bone, nasal bone. Behind here is the sphenoid bone. Okay. So let's go with the assessing of your skull. Assess for the size, okay, the shape, the symmetry of the skull. This is very important in newborns, in neonates. Okay. So the normal finding is that it should be rounded, smooth, and the medical term for that is that it is normocephalic. Normal cephalic head. Normal head. Okay. So this is an example of an abnormal finding. Okay. So you can see the size and the shape of the skull of the baby. No, it's not normal. It's very enlarged and it's not symmetric. So this is actually due to hydrocephalus. Okay. Hydrocephalus, it occurs when there is an abnormality in the flow of the cerebrospinal fluid. So the cerebrospinal fluid is the fluid that floats around the brain. No, it cushions the brain so that when you move your head, the brain is not easily injured. Okay, so shown here is how we actually produce CSF or cerebrospinal fluid. Okay, so the CSF is produced and secreted by the choroid plexus in your ventricle. Okay, this is the lateral ventricle. This is located in the brain. So the CSF flows through this foramina, the interventricular foramina, into the third ventricle, and then the choroid plexus of the third ventricle adds more cerebrospinal fluid. The cerebrospinal fluid flows down to the cerebral aqueduct into the fourth ventricle, okay, this area. Okay, and the CSF flows out the lateral apertures and one medial aperture. So meaning, pagdating dito, lalabas siya tapos magsisirculate siya around the brain, okay, and the spine. Okay, the CSF fills the subarachnoid space and bathes the external brain and the spine. So, how do you produce hydrocephalus? If you have anything that blocks the flow of the cerebrospinal fluid, say for example, you have a tumor in this area. Okay, so if you have a tumor in this area, that would block the release of the cerebrospinal fluid. If that happens, you would have accumulation of the CSF in your ventricles inside the brain. If that accumulates inside the brain, of course, it increases the size of the brain, and at the same time, especially in neonates, no, in very young infants, okay, it can expand the skull. Okay, therefore producing a very enlarged head, okay, such as here, such as in the previous. Okay, so how do we manage? One of the ways to manage is via placing a VP shunt. So basically, you will place tube, okay, inside the brain of the patient to drain the CSF. Okay, so skull assessment, there is lack of symmetry and increased size with prominent nose and forehead. So this one, as you can see, this is abnormal, no? There is a very long space between the eyebrow and the eyes of this baby, no? So this can be due to actually genetic abnormalities. One example is your trisomy 21, okay? So this is a sign of genetic defects, okay? Assessing facial features. So the normal finding is you should have symmetric facial features, should be round, oval, square, or elongated. That's the shape of the face, right? And the palpebral features should be equal. So these are your palpebral features in your eyes, right? And you should have symmetric nasolabial fold. So this is your nasolabial fold, the crease around your nose and your mouth. So of course, if there is no symmetry in the facial features, that can mean an abnormality. So if you have this one, okay, this is werewolf syndrome or hypertrichosis, meaning hyper madami trichosis hair. Okay, this shows prominent facial hair. This is genetic. Okay. If you have exophthalmia, so the eyes are bulging out, that's exophthalmia. Okay. This is a FASI. No? FASI means a distinctive facial expression associated with a clinical condition. This is bird fasci. Okay. And this is due to genetic defects as well. Okay. Another example of a fasci is a moon fasci in Cushingoid syndrome. Ayan, this is your moon fasci. Parang ang taba kasi nung patient, no? The patient gets very fat, no? High fat deposit in the face na nagiging moon-like, no? Yung shape ng face niya. This happens in Cushingoid syndrome or Cushing syndrome. No? You have high steroids, no? Corticosteroids in the body, causing you to develop obesity and increase in fat deposit all over the body, not just the face. Okay. So this is Leonine fasci. This happens in leprosy or Hansen's disease. So of course, this is due to your Mycobacterium leprae. Okay. And so this is a very severe type of leprosy, no? Assessment of the eyes. So inspect the eyes again for edema, right? If there is edema around the eyes, that can mean again kidney injury. Okay, one of the examples. Also, if only one eye is edematous, baka may kumagat pala, no? Baka may kumagat na insekto sa mata. Okay? Pwede din siyang cause of allergy, no? Baka nag-allergy yung patient, so naghubag or namaga yung around the eyes. There's around the eyes. Again, for hollowness, no? If the eyeballs are sunken, that can mean dehydration. And of course, there should be no edema and no hollowness. Okay? This is edema. Yan. Edema around the eyes. That's called periorbital edema. So this one, this is of course eye bags. This is an example of your sunken eyeballs. Okay. Yan, this is due to dehydration. No? Sobrang dehydrated na ng patient na to. Okay, so what happens? There is decrease in CSF volume and even decrease in tonicity of the eyes. No? Kulang yung tubig. Kaya siya umaatras. mass. Okay? Again, sign of dehydration. Assessing facial symmetry. Again, ask patient to elevate eyebrows, frown, lower the eyebrows, close lids tightly, puff the cheeks, smile, and then shrink. Other assessments of the face, of course, check for nodules, masses, depressions, even pimples, right? No moles, okay? So, of course, moles are normal, okay? But in general, there should be no nodules and no masses, okay? So, this is an abnormal facial finding due to trauma. Grabe na yung trauma dito. Okay, indicate which area has abnormalities such as depression from local trauma. So ito baka na-aksidente yung pasyente, nabangga, motor vehicular accident, causing this kind of facial trauma. This is very, very severe. Okay. So this is nice to know, but sometimes they ask this in the exam. Okay, this is your classification of facial fractures. The name is Lefort fracture. You have 3 types, type 1, type 2, and type 3. So in type 1, this area of the maxilla is affected. Ito lang, ibig sabihin yung may fracture. Okay? For type 2, you have a bigger area of the maxilla and the nasal bone. Okay? Is affected. For type 3, the zygomatic bones are also affected. So you have the zygomatic, the nasal, and the maxilla. Okay? So this is your facial fracture, example of a facial fracture. This is type 2, as you can see. The zygomatic bones are still intact, so it's not, this is type 3. So as you can see, you have, even the mandibles are affected. No? So you have fracture here in between your zygomatic, on the right zygomatic bone. You have a nasal fracture, and even the sphenoid, the lacrimal bones are affected. And of course, a very big fracture on the maxilla. Okay, so of course this manifests in x-rays, okay, but in a gross examination of your patient, this is what you will see. There is great evident facial asymmetry, right? As you can see, the mouth is not symmetric, even the nose, okay, and the cheeks, the patient. Of course, there is redness and swelling around the eyes and all over the face. It's swollen. So that would mean inflammation, hemorrhage. Okay. Lifespan considerations. So for neonates and newborns, shape of the head can be different. Depends on the type of delivery, vaginal or cesarean section. Of course, this is not that's not a real picture of a neo, no? So in vaginal delivery, neonates can sometimes have elongated or molded heads. Now, let's see if we have a photo. Ayan. So ito, kita nyo, molded yung head niya. The head of the baby is elongated. This is because, of course, the baby passed through the vaginal canal, which is very tight, no? So during delivery, pinapanganak si baby, ang sikip-sikip ng daluyan, no? Para makalabas siya sa womb. Okay? So dadaan siya ng vagina ng kanyang mama. So if the vaginal delivery or the labor is prolonged, that can mold the head into different shapes, no? Pwede maging elongated, such as in this. Okay? So normal shape of the head becomes more rounded after 1 to 2 weeks. Meaning, after 1 to 2 weeks, babalik din yan sa normal. Okay? So of course, in cesarean section, Kasi hindi naman dumaan si baby sa masikip na vaginal canal, so normal ang head ni baby. Okay? Kapag CS yung way of delivering the baby. Okay? So let's go with your fontanelles, no, in neonates. So these fontanelles, these are the spaces in between the major bones of the skull. So the purpose of this is as the baby or as the child grows, the brain expands or the brain grows as well. Okay, so this gives space for the brain to enlarge and mature. Okay, of course, pag adult ka na, wala na yung spaces na yan, no? Kasi fully developed naman na yung brain na. Okay, so here, dito muna tayo. Okay, so this is the frontal bone, right? So what separates the frontal bone from the parietal bone is your anterior fontanelle. This is a diagonal shaped fontanelle. Okay? So if you do an x-ray of skull of the newborns, ganyan siya. Hindi pa buo yung skull. Meron pang spaces. Those are your fontanelles. Again, frontal bone, parietal bone, anterior fontanelle. Okay? Again, diagonal or diamond-shaped fontanelle. The fontanelle at the back, okay, separating the parietal bone and the occipital bone is your posterior fontanelle. This is a triangular-shaped fontanelle. Okay? Again, you have fontanelles when you were born, or neonates have fontanelles to give way for the brain to develop and grow. Okay? Kasi syempre yung neonates, no? Pag pinanganak yan sila, maliit pa yung brain niyan. Pag sarado na yan, tapos, pag bone na yan lahat, no? There will be no room for the brain to enlarge and mature, no? So, dapat may spaces. Okay? Okay. So, the time of closure, meaning mag-fuse na yung bones, okay, around the fontanelle. Ayan. So, anteriorly, no, the anterior fontanelle, it takes 18 months for it to close. So, dapat pag 18th month ni baby, magko-close na yung fontanelle. Okay? If it's still open, then that can mean an abnormality. Whereas, naman, if 1 month pa lang si baby, close na yung anterior fontanelle niya, then that's abnormal as well. Okay? For the posterior fontanelle, it closes earlier, 8 weeks or 2 months. Okay? Head movement of neonates, they can slightly lift their heads and move side to side. No? There is still poor head control. So, at 4 to 6 months, they establish voluntary control. Meaning, kaya na nilang mas igalaw yung ulo nila, kaya na nilang mas i-carry yung head nila. Okay? So, that's it for the skull, face. Let's continue with our discussion. Now, we go with the eyes. Okay, so review of anatomy of the eyes. So, this is your external gross anatomy of the eyes. So, what we have here? We have the eyebrows, we have the upper eyelid, eyelashes, okay, the conjunctiva, okay, dito yan, sa loob, or sa ilalim ng eyelashes. Okay, we have the sclera, the white part of the eye, the pupil, and the iris. Okay, so here we have the medial commissure, lateral commissure, okay, The palpebral fissure is the space in between your eyelids, the upper and the lower. Okay? Lacrimal caruncle, meaning the drainage of the tears. Let's go with the orbits, meaning the bone or the area where the eyes and the extraocular muscles are located. So quadrilateral pyramids, the bases face anteriorly, whereas the apices or the apices are pointing backward and medially, and the medial sides are parallel. So ano ibig sabihin nun? Ibig sabihin lang, yung mata, hindi siya straight na nakaganyan. It's not straightly located inside the orbit, no? So the bases face anteriorly, the apices, this area, points backward and medially. Nakapaside siya, no? You see? Pointing medially. And the medial sides are parallel to one another. Okay? So the orbit is formed by 7 bones. The orbital roof, meaning the bone at the top of your eyes, is composed of your frontal bone and your sphenoid bone. Medially, you have the ethmoid, maxillary, lacrimal, and sphenoid bone. Laterally, you have your zygomatic and sphenoid bone, and the orbital floor below the eyes, you have your maxillary, palatine, and zygomatic. Okay? Ayan. So, this is your orbit. This is the optic canal. As you can see, butas siya, no? So, this is where your optic nerve, okay, passes. Yan yung daanan ng optic nerve. Dun siya dadaan sa optic canal. From the brain, okay, to your eyes. Okay? So, this is the frontal bone, sphenoid, the yellow one, zygomatic, maxillary, palatine bone, very small, ethmoid, and the lacrimal. Okay? So, is the nasal bone part of the orbit? No. The eyelids, you have your palpebral fissure. Again, they are the area between the upper and lower eye. Has 2 angles, the lateral and the medial. Lateral is the temporal side, medial is the nasal. In the medial area, you have your caruncle. Okay, this is a small protuberance of modified skin. You also have your plica semilunaris, which is the tissue fold behind the caruncle. Each lid has a punctum at the nasal aspect. The skin overlying the eyelids is the thinnest, no, among all skins in the body. Okay? Especially yung sa lower lid. No? That's why if you rub your eyes all the time, madali siyang iitim. It will easily die. Okay? If it dies, it gets black. So yun yung eye bags and darkened skin around the eye. Okay? The eyelids are supplied by your facial nerve, which is your cranial nerve 7, and your oculomotor nerve, cranial nerve 3. So the muscle around the eyelids are your orbicularis oculi. Again, supplied by the facial nerve, no, and the oculomotor nerve. The sclera, the white part, is the outer protective layer of the eyeball. It is modified anteriorly to become the cornea. The cornea is transparent. Ayan. So that's your cornea, transparent area or passage where light rays enter the eyes. Okay. So yung cornea, yun yung nasusugat pag, say for example, na-scratch mo yung mata mo, no? Pwede siyang masugat. Okay. Pwede, dun din dumidikit yung mga dust, yung mga particles kapag may mga particles or dust na napupunta sa mata. Okay. The choroid, it's this one. It's found inside the sclera. It is highly vascular. It is a layer, no? Highly vascular layer that nourishes the structures in the eyes. Okay. Yan, this is the choroid. So again, di ba? Cornea, this is the lens. Okay, iris. Sorry, pupil. Then the lens. Then the layer immediately. Okay, the innermost layer is your choroid. That's where your retina is attached. The retina is where your receptors for vision are located. So yan, lines the posterior two-thirds of the choroid. That's your retina. Again, that's where your receptors are located. Okay, so you have different receptors, right? The cones and the rods. So cone is for day vision, rods is for night vision. So next we have the lens. Okay, so the lens is also transparent. It's in the middle, no? It is held in place by zonios. So these are your zonios. And this is a very better photo, no? So this is the cornea, transparent yan. Okay, so this is the pupils. That's the one that dilates and contracts. Behind that is your lens. Okay, so the lens is in place in the middle via your zonios, your ciliary zonios. These are fibers. Okay. So next layers, you have your choroid. This is the choroid, vascularized structure, no? So yung vessels. Retina is your neural structures where your receptors are located. The vitreous humor, that's the one that gives shape to your eyes. No, that's a fluid. Okay, gives tonicity, gives shape to the eyes. Okay. Again, zonule holds the lens in place. They are attached to your ciliary body, also known as the lens suspensory ligament. Ciliary body, this one, dalawa, no? Superior and posterior, is a thickened anterior part of the choroid. They contain circular and longitudinal muscle fibers that attach near the corneoscleral junction. So the iris, this is the colored or the pigmented part of the eye. Okay, so sa iba, blue, gray, green, no? Most common is brown. Contains circular muscle fibers that constrict and radial fibers that dilate and controls the size of your pupil. Okay? So, this is how you detect light, no? Or this is how you see. This is how you see the world around. Okay, so what happens? You have the image here, the light here goes through your cornea, which should be transparent, into the pupil and the lens. Okay, and the light rays will be directed to your retina. So in the retina, that's where your cones and rods, your receptors are located. They detect light rays. Okay, so another photo. Okay, section of the eye. Physiology of vision. So this is the neural pathway. So the light stimulus is detected by the receptors in your retina. Okay. The signal, once you open your eyes and you see a light, okay, the light stimulates the receptors in the retina. The stimulation goes to the optic tract and ends in the thalamus. Okay? But what happens here is that fibers from the nasal half, meaning nasal medial part of the nasal half of the optic nerve, crosses to the other side, whereas the temporal half does not cross. Okay? So then the geniculocutaneous tract passes to the occipital lobe where the vision is interpreted. So remember the area or the primary area for vision is called your Brodmann's area 17 and it's located in your occipital lobe. Okay. So let's go with others eye signs or conditions. First, eyelid signs, you have external hordeolum and internal hordeolum. So the medical term for sty is hordeolum. Okay? External hordeolum, meaning it's externally located, no, beyond the eyelid. If it's internal, then it's in the conjunctiva. Okay, so this is due to infection. Most of the time, bacterial infection. Okay, especially if you have a blockade in your drainage of tears because you have uh, tear ducts along your conjunctiva. If the ducts are clogged or blocked, no, that can be a nidus or infection. Okay. So you have pterygium and pinguicula. So this is an overgrowth of cells. No, pterygium is a triangular shape overgrowth, while pinguicula is a circular shaped overgrowth. Pterygium is the one that can cross the iris. Okay. Lens signs, cataract. Okay. So, a cataract is a cloudy area in the lens of your eye, okay, which is the lens focuses the light, right? So, cataracts are very common with aging, okay? But this can also be due to uh, other metabolic diseases such as diabetes mellitus. Okay, so in order to get rid of cataracts, a patient has to undergo surgery to remove this. Okay, here, subluxation means displaced lens. So the lens are displaced. Remember the one that the structures that put your lens in place are the zone. So if there is a problem in putting the lens in place, this can happen. Okay. So other name is ectopia lentis. One cause is Marfan syndrome, which is a genetic disease wherein you have a problem with your cartilages, ligaments. Okay, so that can also affect your zonules in the eye and eventually cause displacement of your lens. Okay. Let's go with lifespan considerations. Sorry, before we proceed, for the cataract, because of the opacity of the cataract, that would cause problems in vision, of course, because the light cannot pass through the lens. Okay? So again, lifespan considerations. First, for infants, depending on the age. No, it's true that when we were born, no, we cannot see the world as clear as when we were adults. Okay? No. Ano pa, malabo pa yung paningin natin noon. Baby pa tayo. Okay? So at 4 weeks of age, infants can gaze at and follow objects. The first color that we see is color red. Okay, later on, magpa-follow yung primary colors, no? Yellow and blue. And then later pa yung other colors. At 3 months, we should start manifesting tears. At 4 months, visual acuity is 20/300. So, ang labo, no? And of course, that will improve eventually. 6 months, can focus with both eyes. Okay, so this test, the Hirschberg test, this is conducted for detection of amblyopia or lazy eye. So amblyopia or lazy eye in layman's term, of course, when you have an abnormality in one of your extraocular muscles. So meaning one of the muscles that control the movement of your eye is not functioning properly. So how do we detect that early? No? So we use Hirschberg test. So this is cover test plus corneal light reflex. So how do you do that? So a pen light is held 1 meter from the eyes of the patient, and then the pupillary light reflex is observed and its relationship to the center of the pupil. Okay, of course, when the pupils are very symmetric, right? When you shine a light, the light will be symmetric as well. Okay? But in patients with amblyopia, okay, such as this one in the photo, no, the reflex of the light will be displaced, especially in one eye. So here, as you can see, this is actually esotropia. No, the reflex is displaced. No, the reflex is displaced here in this left eye of the patient. Dito, nasa gitna, pero dito, displaced siya. So, that would mean amblyopia. So, there is an abnormality depending on where the patient is looking, no? Baka kasi nakatingin pala siya sa right or left. So, hindi natin masyadong ma-determine. Say, for example, this patient is looking straight from the right. Okay? Straight from the right. Okay? So, anong nangyari? Naiwan. From looking to the right, no? Yung left eye, naiwan siya na nakatingin sa right. Okay? Nakatingin siya nasal. Meaning, merong laziness here on the muscle on the temporal side. Dito yung problem. Ito yung hindi nagko-contract ng maayos. Okay? Okay, so amblyopia or lazy eye should be managed, no, as early as possible because there is doubling of vision in patients with amblyopia. Can you imagine? Yung nakikita ng right eye niya is diretso, yung nakikita ng left eye niya iba. So maguguluhan yung brain. The brain will have a problem in interpreting what is the patient really looking at. No? So if hindi yun ma-manage properly or early, ang gagawin actually ng brain is bubulagin niya yung isang mata. Okay? So to prevent that, we have to manage amblyopia early. So epicanthal folds, common in Asian ethnicities. Yeah. nakababa, no? May cover the medial canthus and may cause the eyes to appear misaligned, may be present in other races before the bridge of the nose begins to elevate. But that's normal. So for children, especially in preschool, no, the vision can be checked using e-chart. So instead of letters, we have figures, no? So we have a house, umbrella, apple. So, kailan magte-2020 yung vision? 6 years of age. Okay? From 2300 at 6 months, no, naging na siyang 2020 at 6 years. Perform acuity test with glasses on if child has a prescription to wear lenses. And consider conducting Hirschberg test as well. For elderly, visual acuity decreases as the lens of the eye ages and becomes more opaque and loses its elasticity. Okay, so diba, cataracts are common in aging, and of course, the elasticity of the lens decreases as well. So meaning, the changing of the shape of the lens is decreased. Diba? When you are looking at near objects, the lens change in shape. When you are looking at far objects, the lens change in shape as well. Okay. At the same time, the ability of the iris to accommodate darkness and dim light diminishes. So, dilation of the pupil diminishes when you are in old age. There is also diminishing peripheral vision due to gradual loss of receptors in your retina. Okay? And at the same time, decreased ability to adapt to light and dark. So this is an example of diminished peripheral vision. No? So central na lang yung nakikita. Decreased accommodation for near objects happen as well. But there is possible improvement in far vision. Diba yung mga matatanda, ano sila humawak ng phone or magbasa malayo sa kanila? Kasi mas better yung vision nila pag mas malayo kesa mas malapit. Kasi there is less accommodation. Okay? So what happens near point of vision, meaning 9 cm. 9 cm siya, so malapit, no? Pag 10 years old. Okay? When you age, no? Middle-aged adult ka na, 40 to 45 years old, reading and close work becomes more difficult. And when you reach the age of 60, so your near point of vision is 83 cm. So from 9 to 83, malayo, no? Lumayo siya. Leads to eventual hyperopia or farsightedness. Many elderly wear corrective lenses which are convex in shape because of a further near point of vision. Meaning, mas malayo yung nakikita nila na klaro. Okay? If you have myopia, you have concave lenses. Visual changes occur due to loss of elasticity again of the lens and transparency as well. The skin around the orbit may darken, no? Yung eyelids. And the eyeball may appear sunken. Kasi this is not due to dehydration. This is due to decreased orbital fat. Okay. The skin folds of the upper eyelids may become prominent, lumulubog, no? Nagsasag, no? Yung upper and lower lid. And the eyes may appear dry and lusterless, meaning there is the eyes are not shiny. Hindi siya makintab, no? This may be due to decreased tear production, no? Konti na lang yung tears na napoproduce. So, parang dry tignan yung mata. Okay? This is arcocinilis, grayish white arc or ring around the cornea. This is normal in elderly due to accumulation of lipid substance or fat around the cornea. Your cornea is transparent and does not have a direct blood supply. No, so it only gets nourishment via diffusion. So as you age, slowly there are fat deposits around the cornea and therefore causing arcocenitis. Okay? Iris may appear pale with brown discolorations, and the cornea tends to cloud with age. That's your what was that? That's your cataract. Okay? Conjunctiva may appear paler and may have yellow fat deposits. Pupillary reaction to light accommodation is still equal pero mas mabagal, no? Less brisk, mas mabagal. Pupils can appear smaller in size, okay, unequal and irregular in shape. This is due to sclerotic changes in the iris, which controls the dilation and constriction of the pupils. We're done with the eyes. Now let's go with the ears. So review of anatomy of the ear. We have the ear is divided into three main parts: outer ear, middle ear, and inner ear. So outer ear, gross appearance of the ear. Sorry. So the function of the outer ear is to direct sound waves to the auditory canal. Okay. Again, if you remove this, no, if you remove your pinna or your auricle, it will be harder to determine where a sound is coming from. Okay. So this is your helix, antihelix. This is your lobule, the tragus, antitragus. Okay, and of course the entrance to the auditory canal or ear canal. This is your middle ear. Middle ear is from tympanic membrane to your oval window. Okay, so outer ear, auricle, to tympanic membrane. Middle ear, tympanic membrane to oval window. Inner ear, oval window, of course, to the nerves. Okay, so the middle ear is composed of your tympanic membrane, your ossicles, meaning the malleus, incus, and the stapes, the bones in the middle ear. Okay, and the tympanic cavity, which is actually connected to your auditory tube, which is connected to the nose. So the middle ear is air-filled. It contains the tympanic membrane and the ossicles. So this is the appearance of a normal tympanic membrane. No, it's pearly gray with a cone of light. Okay, you can easily visualize the handle of the malleus and even the lateral process of the malleus. So this is an abnormal one, perforated, no? So those are the bones. You have your malleus, incus, and stapes. So again, they are for impedance matching. Okay, so that the loudness of the sound that the brain interprets is actually the same with the sound wave that entered the outer ear. Okay. Inner ear is composed of your cochlea and vestibule. Okay. So the cochlea and the vestibule is composed of two labyrinths. This is fluid filled, meaning labyrinths, parang cave, no? Daluyan. Okay? So the daluyan or the labyrinths are filled with fluid. So you have two labyrinths, bony and membranous. So in the bony labyrinths, you have the semicircular canal, the cochlea, and the vestibule. This is the cochlea. Okay, this is the vestibule. The semicircular canal, sorry. Okay, you have three. No, anterior, lateral or horizontal, and posterior semicircular canal. This is the vestibule. So types of fluid, you have perilymph and endolymph. Perilymph outside the duct, endolymph inside the duct. Okay. So how do you actually perceive sound? Okay. So it's through sound waves, right? So the sound waves from the environment, okay, pushes your tympanic membrane, which pushes your ossicles, the malleus, the incus, and the stapes. The stapes then pushes the oval window, which causes a flow in the perilymph, okay, where the flow of the fluid or the flow of the perilymph, that's the one that activates the receptors for hearing. Okay? So if actually sobrang malakas yung sound wave, malakas yung pag-push sa tympanic membrane, mas malakas din yung pag-push sa fluid, no? Mas malayo yung ma-reach niya or ma-activate niya na receptor, that will be perceived as a loud sound. Okay? Yung low sounds naman, mas mahina or mas mababa yung frequency, okay? Mas light yung pag-push ng tympanic membrane and therefore pag-push ng fluid. So, mas malapit lang yung na-activate na receptors that will be perceived as low sound or soft sound. Okay? So, let's go with cerumen, also known as earwax. This is produced by the outer ear, by the cells that line the outer ear or the ear canal. So, what's the function? It is a lubricant that prevents desiccation of the ear canal, and it also has antibacterial properties. It is acidic, it has lysozymes and antibodies. Okay. So we have two types of cerumen. We have wet and dry. So wet, no, the cerumen is moist, common in Africans and Europeans. Dry, common in East Asians and Native Americans. No? I actually don't know, no, what's the purpose of, or why are they different? Why is there wet or why is there dry? I'll try to read them. Okay. Let's go with physiology of hearing. So, neural pathway. So, what happens if you hear a sound, you activate the receptors in your cochlea. What happens to the signal from the receptors? They go to your acoustic nerve, which is your cranial nerve 8, the nerve for hearing. Okay? Then, from the cranial nerve 8, it goes to your dorsal and ventral cochlear nuclei. Okay? So this just shows the pathway of the sound to your auditory cortex, where the sound is interpreted in the brain. Okay? So the auditory impulses then goes to your inferior colliculi, so from here, from the ear, here to the colliculi, okay, which is the center for auditory reflexes, then goes to the medial geniculate body of the thalamus and into the auditory cortex, which is in the temporal lobe. Okay, another figure, again, cochlea, where your receptors are, the nerve, which is your cranial nerve, vestibulocochlear nerve, okay, goes to the inferior colliculus, to the medial geniculate in the thalamus, and then in the auditory cortex in your temporal lobe. Let's go with ear signs. Let's go with this one by one, okay? So this is an earlobe crease, visible crease, no, extending at least 1/3 of distance from pterygos to posterior pinna. This is associated with possible coronary heart disease. Earlobe nodules. So these are hard masses, no, located in the helix or antihelix. Yeah. So these are actually due to gout, no? So, gouty tophus ang tawag dyan. So, what is gout? It is due to elevated uric acid, no, in the blood. The uric acid in the blood can precipitate in any part of the body, even the ears. So, if the uric acid precipitates here, it becomes crystals and then it hardens. Okay, and it becomes gouty tophus. So this is painless, hard, and irregular. You give medications to this patient, this will eventually, gradually, no, become less and less until mawala na siya. Okay? So yan, closer look. No, gouty tophus may have discharges. So this is Darwin tubercle, which is a developmental eminence in the upper third of the helix. This is harmless, but it must be distinguished from gouty tophus. Okay? So this is less, the gouty tophus is harder. When you palpate the mass, no, the nodule for gout is harder than this one. Ito medyo parang cartilaginous pa yung feeling niya. This is ear hematoma. This is due to trauma. So what happened due to trauma? The blood extravasated and caused hematoma. So this leads to blocked the accumulation between ear, cartilage, and the pericardium. So if you do not treat ear hematoma, it can cause cauliflower ear. This is called cauliflower ear. No? Yan. So, untreated hematomas heal as nodular and bulbous irregularities. But, if the trauma is severe, no, the healing process is not perfect and it can result to that one, the cauliflower. So these are examples of ear trauma, no? Cut yung helix, antihelix, even the tragus. So ito, you can suture this, no? And it will eventually heal. So next, let's go with ear discharge. The medical term for ear discharge is otorrhea. Oto meaning ears, no, rhea, discharge. This may be bloody. If it's bloody, that's otorrhea. Purulent, clear, serosanguineous. Ayan, no? This is a pus again. So this can be pus or melted serum. This is blood naman or pus pa din. So this is blood, no? Due to temporal bone fracture, otorrhea. Okay? So you can also have cerumen impaction, maybe due to excessive production of earwax or a narrow nape. So this can cause abnormalities in hearing. No, this actually causes conductive hearing loss. So what does that mean in Weber test? That would mean that the sound will lateralize to the area or to the ear where there is cerumen impaction. But the Rene can still be normal or abnormal. Yeah, impaction. No? At the same time, cerumen obstruction can also lead to tinnitus and dizziness. Okay? So this is an abnormal finding of your tympanic membrane because you can see it's bulging. No? So this is seen in middle ear infection or otitis media. Okay, meaning middle ear infection. So what happens? Because of the infection inside the middle ear, no, it's actually full of pus inside. No, the pus that is that accumulated inside the middle ear can push the tympanic membrane, and then the tympanic membrane bulges outward. Okay, so as you can see, if you do otoscopy, you won't see the bony landmarks, meaning the handle of the malleus in the tympanic membrane already. You would have distorted light reflex. If this is not properly managed, no, say for example, you encountered a patient that with this one in the future, okay, if you did not treat the infection properly, this one, the tympanic membrane can eventually perforate, meaning mabubutas siya because of the elevated pressure in the middle ear. Okay, so when that happens, okay, when the tympanic membrane perforates, that's when the pus from the middle ear goes out, no, from the ear to the ear canal. Okay, so magkaka-otorrhea na yung patient. So normal, abnormal. Okay, again, otitis media, middle ear infection. The common cause of middle ear infection is upper respiratory tract infection. Why? Because the middle ear is connected to your nose. Okay, if you have infection in your nose, you have colds, you have rhinorrhea, which is the medical term for colds. Okay, if you do not treat your rhinorrhea properly, okay, and the symptoms are prolonged, eventually the infection can spread to the ear. Okay, again, because the ear is connected, specifically the middle ear is connected to your nose via the eustachian tube. So this is loop or bat ear. This is genetic. The pinna protrudes at the right angle. So this may be due to shortage of skin, cartilage, or bone. So this can actually be managed via surgery for aesthetic reasons. Okay. This is microtia, meaning small ears. Okay. Ayan. So, microtia can actually occur, this is also genetic, no? Can actually occur in syndromes such as trisomy 21, no? Down syndrome. Okay? So, this can also be managed surgically for aesthetic purposes and for better hearing, right? Because again, the pinna, okay, directs or collects the sound. Macrotia, large ears. Okay, unusually large ears. Still genetic. Perforated tympanic membranes. Ayan. So, aside from perforation of the tympanic membrane due to middle ear infection, this is still the most common cause of perforation of tympanic membrane. It's manipulation, no? If you manipulate your ears with your finger, with a stick, with cotton buds or Q-tips, okay, you can puncture your tympanic membrane and of course perforate it, okay? So, that's why actually any manipulation of the ears is not advised. Even use of cotton buds is not advised, okay? Even by doctors, okay? Because the earwax, no, if it is not impacted, it will go out on its own. Okay, you actually do not need to remove it using Q-tips. Okay, so if this happens, no, if you perforate your own tympanic membrane, okay, uh, the healing, meaning uh, yung pagbalik niya sa normal, no, nung butas, the healing process takes 2 to 4 months. Okay? And at the same time, the chance or the percentage that it goes back to normal is only 50%. 50% of the time, it stays perforated for the rest of your life. Okay? So if it is perforated, there will be a lot of things no, na bawal for the patient. Bawal na siya mag-swimming. Bawal mabasa yung tenga niya. Kapag maligo siya, dapat covered ang ears. Because once mag-swimming siya, papasok yung tubig. Okay? And dahil butas yung tympanic membrane, the water goes inside the middle ear. And that would cause infection. Okay? Ayan, perforated tympanic membrane. No? Again, perforated tympanic membrane. Most of the time in the clinic, no, with my patients, what I see is the perforations are already so big. Okay, and the most common cause, manipulation. Even younger kids, no, they use cotton buds, try to clean their ears, and then they puncture. They perforate their own tympanic membrane. And most of the time, it does not go back to normal. So this is a foreign body or an insect inside the ear canal. So what you can do here is you can drop hydrogen peroxide to try to lead the insect to go out. No? If the insect is already dead, then you have to use or go to a doctor actually, no, and the doctor will use an instrument to get the insect out. Okay, ear symptoms. So let's go with this one by one as well. Tinnitus. Tinnitus is the ringing in the ears. Okay. Okay. Sometimes it happens spontaneously, no, with no medical causes, but sometimes it's due to medical causes, medical diseases, okay, such as vertigo. Okay, so if it's sufficiently distressing, if it happens all the time with dizziness, then you should seek a doctor. Okay, so maybe the first symptom of acoustic neuroma, this is a malignancy, no, of the acoustic nerve. Okay, but this is very rare. So temporary altered hearing happens, no, may happen during swallowing and yawning, and even when there is change in atmospheric pressure, right? When you ride an airplane. Okay. So of course, if you have a retracted tympanic membrane, no, that can also cause hearing difficulties. normal tympanic membrane, retracted tympanic membrane, meaning palubog siya. Whereas kanina yung bulging tympanic membrane, palabas naman na yung tympanic membrane. This is also due to infection, middle ear infection or otitis media. Okay, again, here, temporary altered hearing may be caused by eustachian tube dysfunction, which is the tube that connects your middle ear to your nose. Okay, that's why when you have sipon or colds, right, there is also, sometimes there is ear pain and hearing is diminished, no? You feel, there is a feeling of coolness in the ear, okay? So the medical term for ear pain is otalgia, okay? Arises from inflammation from the ear itself or surrounding structures, okay? So the pain may be feeling of fullness, it can be deep, boring pain, the pain can be intermittent, sudden, or gradual. Possible causes, trauma, hematoma, gout, insect bites. And of course, again, it can also be due to pain in the structures surrounding the ear. So one of those is your jaw, okay, or your teeth. If you have a problem in your teeth, your molars, or your jaw, of course, the pain can be felt in the ear. If you have trigeminal neuralgia, that's a type of headache, no, that occurs in the temporal part of the forehead. This is your temporomandibular joint arthritis, the joint of the jaw, okay? If it has arthritis already, of course, that as you move your jaw, that would cause pain, and the pain can be felt in the ear as well. So this is dizziness and vertigo. The definition is persistent stimulation of the semicircular canals or vestibular nucleus when head is at rest. Okay, so meaning the patient is at rest, the patient is not moving, but it is as if the patient is spinning. Okay, so that spinning motion gives also a feeling of hallucination. So parang ang mga patient na nagdi-dizziness and vertigo, ang sinasabi nila is, or they explain is, as if the room is spinning around them, even though they are just seated down or standing straight, okay? Not spinning at all. So when eyes are open, patient's surroundings seem to be spinning or whirling. When eyes are closed, patient continues to feel as if in motion. Okay? So possible causes, you have different, no, madami. Can be due to migraine, can be due to stroke or cerebral hemorrhage, can be due to intracranial masses, meaning brain mass or brain abscess, okay? Fracture in the temporal bone, even simple ear infection can cause dizziness, okay? So again, it can be due to a lot of causes, okay? But still, the most common cause is benign positional vertigo. Okay, so what happens there is that there is an abnormality in one of the receptors in the vestibular canal, okay, which is the, remember the vestibule is the organ for balance. Okay, so if there is an abnormality in the organ for balance, therefore, balance is not achieved. So the patient, it's as if the patient is spinning. Lifespan considerations. So, all newborns should be assessed for hearing prior to discharge. This is compulsory, no, in hospitals. Okay? So, they use auditory brain response testing to check, to assess for if the patient or if the baby, the neonate, hears properly. But we can also use certain instruments to assess gross hearing. So what you can do, you can ring a bell. In the hospital, what we use is usually we have ball pens, and then we click the ball pen. Then, of course, there will be a response. The baby can turn its eyes or head to the sound, and or pwede silang ma-startle with the sound. They will close their eyes or magulat sila. Okay? And newborns tend to quiet to the sound and may open their eyes wider. Child should be able to turn head and eyes toward the sound. Okay, this is at approximately 3 to 4 months old. To inspect the ear canal and the tympanic membrane in infants, remember, you should pull the pinna down and back. In adults, you should pull the pinna up and back. Okay? So in adolescents, they listen to loud music. No? So this is comparison of sound in decibels. Okay, so the loudest here, this is the quietest. So the normal range for a speaking voice is here, 40 to 60, pwede up to 80. Yan. Ito, beyond 100 loud noise na yan. Okay? Nasa-stress na yung ear natin pag sobrang lakas na niya. In elderly, skin on ear may appear dry and less resilient due to loss of connective tissue. And they have drier or more dry earwax. Okay? The pinna increases in both width and length, and the earlobe elongates. And of course, some of them, some elderly patients develop hair around the helix and antihelix. So the tympanic membrane is also more translucent and less flexible, and there is diminished intensity of light reflex when you do otoscopy. And of course, hearing loss, of course, due to loss of sensory receptors as well. Okay? And what do you call generalized hearing loss in elderly? It's presbycusis. Okay? So there is loss of high frequency sounds first, meaning louder sounds are lost first. And even these sounds, the F, S, sh, and f. Yun yung mga unang nawawala. Affected by presbycusis, conversation may be distorted and result in what appears to be inappropriate or confused behavior. So if you are dealing with elderly patients with presbycusis, of course, we should be more patient. Okay? So that's it for the ear. Let's proceed with our discussion. Now we go with the nose. Of course, the nose is the main organ for smell. Okay? So consists of external nose and the nasal cavity. Both are divided by a septum. This is the septum. Into the right, this is the right, and the left nostril, or right and left halves. Has two elliptical orifices, or the nostrils, and the lateral margin is rounded and mobile. Also called your anal nasi. External nose, the framework, okay, meaning the bones, So above, you have your nasal, this is the nasal bone, and frontal process of the maxilla, and the nasal part of the frontal bone. Below the nose, you have cartilage, okay, plates of hyaline cartilage. So again, Above the nose, you have the nasal bone, nasal part of the maxillary bone, and nasal part of the frontal bone. In this area, these are your cartilages. Okay? So, this is a view of the inside of the nose. No? So, nostril, septum. You have three meatus, which separates the nose, no? And increases the surface area for the nose for smell and for the filtering of air that enters the nose. Okay, so you have the superior nasal concha, you have your middle nasal concha, and your inferior nasal concha. In between each concha, you have the meatus. You have the superior meatus, you have the middle meatus, and the inferior meatus. Okay, again, the function of each concha is to increase the surface area for smell and for filtration of the air, for humidification of the air, no, that enters the nose. Okay. Ayan. So again, other purpose, humidify air passing through the turbinates and the septum, filters air. Okay. The nose is lined by respiratory epithelium, has surface secretory cells, which produce immunoglobulins and inflammatory mediators. So if you inhale, no, droplets that have pathogens, say for example, viruses and bacteria, then you would have um, immunoglobulins and inflammatory mediators that can easily or try to kill the pathogen. Okay, so here we have the sinuses. So we have four main sinuses. You have the frontal, you have the ethmoidal. Oh, sorry, medyo malabo. Okay, and you have the maxillary. And the sphenoid, nasa yung sphenoid. Nasa likod kasi yung sphenoid. Let's see here if may better figure. So the main function of the sinuses is that they produce mucus for the nose, resonance of voice, and lightens the skull. Okay? And protect also the brain from trauma. Here, this is a better figure. You have the frontal sinuses here, the ethmoidal, and the sphenoid behind, and the maxillary sinuses. Okay? Ayan. Frontal sinus protects the brain. Ethmoidal and maxillary protects the eyes. The sphenoidal is the surgical approach to the pituitary gland. Well, it's behind na kasi, no? So, malapit na siya sa brain din, yung sphenoid sinus. Remember that all open into the nasal cavity and all sinuses are lined by respiratory mucosa, which secretes mucus. Okay? These are innervated by branches of the trigeminal nerve. Okay? So let's go with the physiology of smell. How do we smell? Okay? So, if your eyes perceive light, if your ears perceive sound waves, okay, the receptors in the nose, they perceive chemicals, okay, because they are chemoreceptors, okay. So the receptor cells are located in the olfactory epithelium, and these are two neurons that conduct action potentials into the central nervous system. Basal cells of the olfactory epithelium are undifferentiated stem cells that continuously turn over and replace them. So, if your receptor cells for smell are diminished, no? Meaning, say for example, you had COVID, so you had infection, nagkasipon ka, no? Of course, there will be cells in your epithelium that that will die. Okay, along with the cells in the epithelium that dies, meron ding mamamatay na receptor cells that will die. But what's good with that, with the receptor cells in the nose, is that they are continuously replaced. So later on, after a few weeks or a few months, babalik na rin yung sense of smell. Okay? Diba, yung mga, nung nag-COVID noon, one symptom is wala silang panlasa kasi wala silang sense of smell. Okay? So, smell is very important for taste as well. No, they are they are in consensus with one another. Okay? So the cranial nerve that subserves your nose for smell is your olfactory nerve. This is a purely sensory nerve. Okay, carries information from the olfactory receptor cells to the olfactory bulb. Olfactory epithelium are also innervated by trigeminal nerve to detect nauseous or painful stimuli. So, say for example, anong ibig sabihin nun? In general, if you smell nice things or even mabaho na mga bagay, mabaho na smell, no? What is activated is your olfactory nerve. But if you smell something that is painful, no? A nauseous stimuli. One example is ammonia, no? Pwede din spicy, okay? The one that will be activated is your trigeminal nerve or cranial nerve 5, okay? So again, the cranial nerve 5 is only for nauseous or painful stimuli for smell, okay? Olfactory nerves also pass through cribriform plate on their way to the olfactory bulb. So you have mitral cells in the olfactory bulb, which forms the olfactory tract that projects into the prepiriform cortex, the brain, okay, where the sense of smell is interpreted. Okay, so let's go with signs for assessment of the nose. Epistaxis, this is nose bleeding. Okay, this may be spontaneous or induced. So spontaneous can happen anytime, bigla-bigla. Induced if you manipulate your nose, no? Of course, the epithelium that lines the nose is very thin, and the vessels are actually, or the capillaries, the vessels lining the nose, can be easily traumatized. Okay? So the epistaxis, meaning yung pag-bleed pag-bleed sa ilong can be front or back. Pwede siya sa harap, lalabas, or sa likod, sa pharynx. Okay? So, the source of bleeding anterior is your Kisselback plexus. This is a plexus of blood vessels in the nose. If it's posterior, it's your posterior third of inferior meatus. Okay. Local causes, if you're coughing, if you sneeze, if you pick your nose, okay? If you have fracture in the nose, for example, na pagsuntukan ka. Yan. There is foreign body, which is very common in toddlers, no? Yan. Generalized cause, if you have problems in your blood, no? If you have low platelets, okay, if you have problem in blood clotting, no? So of course, that can cause epistaxis, such as in hemophilia and thrombocytopenia. Thrombocytopenia meaning low platelet, okay, which is the main function is for the blood clotting. Pwede din siya mag-occur in infections. Very common example here is your dengue. No, because in dengue, what happens is you have thrombocytopenia. Okay, so yeah, again, if you have thrombocytopenia, which function, low platelets, no, which functions for blood clotting. Okay, the platelets are low, then you are prone to bleeding. So can also happen if you drink certain drugs. Okay, so this is an example of a foreign body. Again, very common in toddlers because toddlers, they are young, no? They don't know what they are doing. They can easily pick up small things. Most of them, they swallow it, they insert it in their mouth. But some of them, they also insert it in their nose, no? So if there is a foreign body in a child, aside from difficulty of breathing, no, one common symptom is also chronic or prolonged rhinorrhea or colds. So, ang nangyayari dyan, kung isa lang yung black, no, kung isa lang yung may foreign body, say for example, dito lang, ito, nagsisipon, pero ito, hindi. Okay? So, that is a clue of, for a foreign body. Okay? So, nasal septum deviation, this happens in trauma. Okay? Ayan. Nasal septum perforation, meaning butas, nabutas yung nasal septum. Hole in the nasal septum, common causes chronic infection, nasal surgery, repeated trauma, cocaine abuse, because in cocaine users, right, how do they use cocaine? They inhale it through their nose. Okay, so that can cause trauma to the nasal septum and eventually make a hole in the nasal septum. Okay, so symptoms. Anosmia is the medical term for loss of smell, may be accompanied by perceived change in taste of food. So the food is bland or unpalatable. Okay, adeusia is the medical term for loss of sense of taste. Again, why? Why do you have adeusia when you have anosmia? Because they are in consensus with one another. They perceive the same, they are both chemoreceptors, therefore they perceive the same chemicals. Okay, so this may be temporary, such as in COVID, right? And or permanent. So results from conditions that irritate and cause swelling of nasal mucosa, such as infections, or obstruct olfactory area in the nose, such as heavy smoking, rhinitis, sipon, sinusitis, infection of your sinuses. Okay? Permanent anosmia naman due to olfactory nerves or olfactory receptor destruction. Okay? Any part of the olfactory nerve, if you destroy it, then you have permanent anosmia. Can be due to cocaine, cocaine use, acid fumes, head trauma. Rhinorrhea is free discharge of thin nasal mucus due to rhinitis, or if it's cold, no? If say for example, you go to a country with snow, no? Because the air is very moist, no? Hindi naman the particles or the water particles in the air will be filtered by as it enters through your nose. So, maiiwan sa labas yung water particles. Kaya parang mag-rhinorrhea. This can also be due to infection, no? Rhinitis. Common and rarely serious. May be clear, purulent, bloody, serous samples. If it's unilateral, can indicate foreign body. Especially if the discharge is foul-smelling, mabaho. Okay? If the discharge is bloody, it can be due to neoplasm or cancer in the nose. If the fluid that goes out is cerebrospinal fluid, that can be due to head injury. Okay? Bilateral rhinorrhea, usually due to allergy, infection. Nasal obstruction may be caused by allergy, inflammatory, neoplastic, and endocrine, mechanical obstruction, and traumatic injury. For nasal syndromes, yan, isa-isahin natin to. Acute rhinitis, okay, colds, common cold. This is due to infection. Most common cause, viruses, specifically rhinoviruses. So, say for example, your classmate has acute rhinitis and then the classmate sneezed in front of you and then the droplet with the viruses entered your nose, of course, you will have the infection as well. So rhinoviruses infect mucous membranes of the nose and sinuses. This leads to inflammation and increased nasal secretions. Therefore, rhinorrhea. Presentation or symptoms, discharge, sneezing, can become purulent, and of course associated with fever and body malaise. Usually lasts 3 to 10 days. Presence of severe local pain suggests complication, and complications can be bacterial sinusitis. So next we have allergic rhinosinusitis. This one, it's not due to infection, it's due to allergy. Okay, this is seasonal or perennial, especially in countries with 4 seasons, no, winter, spring, summer, and fall. So most patients with allergies, especially to pollen, they have they will have the allergic rhinosinusitis during spring. Okay? So, ayan, caused by allergens, can be pollen, molds, dust, mites, okay, animal dander. Presentation is there is itching in the nose and the eyes, okay, rhinorrhea, lacrimation, tearing, no, sneezing as well, and headache. So this is vasomotor rhinitis. Okay, this is non-allergic mucosal edema and rhinorrhea. So what happens? This is associated with vasodilation of nasal vessels. Okay, and because there is vasodilation, you will have mucosal edema and therefore increased mucus production. So this is actually due to chronic environmental irritants. Okay. But what differs vasomotor rhinitis from allergic rhinitis is that this occurs with strong odors and cold air. Okay, in contrast with allergy or allergic rhinitis, the symptoms will not appear in cold air. Okay, but most of the time, allergic rhinitis and vasomotor rhinitis occur together. No? If a patient has allergic rhinitis, most of the time, meron din siyang vasomotor rhinitis. So let's go with suppurative paranasal sinusitis, infection of the sinuses. Okay, so this is due to bacterial infection. So commonly, Streptococcus pneumoniae or Haemophilus influenza. So what happens? Aside from rhinorrhea, you also have severe pain in the face, usually headache, severe headache. Okay, so this happens 7 to 14 days after acute upper respiratory tract infection. The most common cause of sinusitis is acute upper respiratory tract infection. Okay, there is pain and pressure, but there is no fever. And there is severe obstruction of mucus in your sinuses. Okay, so hindi ka actually makahinga ng maayos. Let's go here. Cavernous sinus thrombosis. This is a most feared complication of nasal infections. May cause blindness, death, and the spread of infection. How does it happen? The infection is from the nose, okay, and it spreads to the veins, and therefore later on to the cavernous sinus, which is actually in the brain. 3. Okay, so there is bilateral involvement of the eyes, which causes deep pain, immobilization of the globes, periorbital edema, chemosis, which is swelling of the conjunctiva. This involves, again, kasi nasa, malapit na to sa brain, no? This involves the nerves. Okay, you have your cranial nerve 3, 4, and 6. If the infection spreads to the cavernous sinus, okay, from the nose, okay, the infection will go to the sinus, and located in the sinus are these cranial nerves. Okay, so manifestations, you have sudden chills, high fever, okay, the patient can be comatose, and the patient can die within 2 to 3 days. Okay, so that is cavernous sinus thrombosis. Let's go with lifespan considerations. So a speculum is not usually necessary to assess the septum, turbinates, and vestibule. For infants, instead, we can use or we can push the tip of the nose upward, pataas, and then shine a light. Okay? Yan, so ganun, pag ganun mo lang siya. Kasi, pag gagamit ka ng speculum, that is very invasive for the infant, iiyak na yan agad. Pag umiyak na siya, di mo na siya may examine ng maayos. Okay? So, for the sinuses, not all sinuses are present at birth. So, the first one to develop are your ethmoid and maxillary, then the frontal at 1 to 2 years old, and then sphenoid later in childhood. So, assessing the septum, for children naman, assessing the septum, turbinates, and vestibule is similar to infants. So, you just push the nose up using your thumb with no use of speculum. Kasi nga, that's very invasive. The child will most of the time refuse, okay, and cry. Ethmoid sinuses fully develop by 6 years old. Rare to have sinus problems at this age. Pre-adolescent naman, the most common signs of sinusitis are cough and runny nose or rhinorrhea. For adolescents, they have headache, facial tenderness, and swelling when they have sinusitis. For elderly, there is diminished sense of smell due to decreased number of olfactory nerve fibers, and also atrophy of the remaining fibers. They are less able to identify or discriminate between odors. Therefore, they have hyposmia, which is lower sense of smell or diminished sense of smell. In contrast with anosmia, which is loss of smell. Okay, hyposmia is diminished sense of smell. They also have nosebleeds that occurs usually due to hypertension. And that's it for the nose. Let's proceed with our discussion. Let's go with the mouth and the oropharynx. Okay? So, must know terms. Isa-isahin natin. So, caries is our dental caries. Okay? Multifactorial microbial infectious disease characterized by demineralization of inorganic and destruction of organic substance of the tooth. So if you see caries in a patient, you have to refer them to a dentist. Okay? So this is one of the causes of caries is acidogenic urine. So what happens here is that the bacteria, which is your Streptococcus mutans, causes acidity in the tooth. And that causes demineralization of the tooth. Therefore, caries. Okay? So, plaque. Plaque is an invisible soft film of enamel which may be bacteria, saliva, or epithelial cells. Tartar is different from plaque. Tartar is an unchecked plaque. Okay, this is already hard, in contrast with plaque, which is soft, no? So again, tartar are visible hard deposits of plaque and dead bacterium at gumland. So if you see tartar in a patient, you have to refer them to a dentist as well. This is a sign of poor oral hygiene. Ayan. So, pwede naman siyang alisin, no? Ng dentist. Gingivitis, inflammation of the gingiva or the gums. So what happens here is you have red swollen gums. Okay, so gingivitis can be due to different causes, no? Usually dental problems. Okay, if you have caries, that can also cause gingivitis. Pwede din viral infection such as HPV can cause gingivitis as well. Okay. Glossitis is inflammation of the tongue. Yeah. So this can be due to, again, different causes. Pwede trauma, no? Pwede din HPV infection as well. Okay. Pwede din vitamin B deficiency. For stomatitis, inflammation of the oral mucosa. So this is a mouth or oral ulcer. No, usually due to trauma to eh. Nakakagat mo yung dila mo, no? Or labi mo. Tapos later on, magkukos na siya, magpo-form na siya ng pus. Parotitis is inflammation of the parotid gland. Okay, most common cause is your mumps virus. Okay, remember mumps? In Bisaya, bayuok. Yeah. So that causes parotitis. Okay, usually unilateral facial asymmetry, swelling, and then it's painful and tender, no? Itong area na to, yung parotid gland. So what happens here is that the mumps virus, most of the time, they infect the parotid gland. Okay, yun yung gusto nilang pinupuntahan at ini-infect. Okay? Okay, swords, accumulation of foul matter like food, microorganisms, and epithelial cells in the mouth associated with chronic debilitating disease. Okay, let's go with lifespan considerations. So for neonates, elderly, so for neonates, for newborns, no, they may have this what you call Epstein pearls. No? So these are pearly white nodules in the gums. Okay? So pagkapanganak ni baby, no? So pag-inspect mo sa gums niya, may ganito, parang pearly white nodule. That's called Epstein pearls. That's actually normal. Okay? That resolves without treatment. So, say for example, no? A mother just gave birth to a baby. Tapos si mommy, nakita niya to. Tapos nagpanic siya. Tinawag ka niya, nurse. Sabi niya, nurse, may problem sa anak ko. Parang may abnormal sa gums niya. Tapos nakita mo, mommy, that's just Epstein pearls. Okay, so you don't have to worry because that is common in neonates and they resolve even without treatment. Okay, so napakalma mo sila. This is bifid uvula. Okay, so what happens, di ba, uvula dapat isa lang yan. And that should be midline. So here, almost nagse-separate na yung uvula. Okay, so bifid uvula may suggest an unsuspected cleft palate, meaning the palate, okay, the soft palate of the patient or even the hard palate did not close. Okay, a cleft in the cartilage that is covered by skin. So in infants, it's very important that you inspect the palate and the uvula for cleft. Diba? Cleft lip, cleft palate. Okay. First teeth erupts at about 6 to 7 months of age. So it's important that you have to assess the dental hygiene kapag meron ng teeth si baby. Parents should be taught To clean infant's teeth with a soft cloth or soft bristled brush. Okay? Usually mild toothpaste pa or kahit nga walang toothpaste pwede. Okay? Also, you can give, pag may ngipin na siya, you can give fluoride supplements. Okay? If child's drinking water contains less than 0.3 parts per million of fluoride. Okay? So, kailan dapat magpa-dentist? At 12 months of age. Tooth development should be appropriate for age. White spots on teeth may indicate fluoride ingestion. And of course, at 2 years old, drooling is very common. Mahilig maglaway ang mga baby. No? So actually, development of teeth, no, diba, the first teeth erupts at 6 months. Okay? Tapos per month, may lalabas na isa. Okay? So, in children, tonsils are normally larger than in adults. So, they commonly extend beyond the palatine arch until 11 to 12 years. This is abnormal, rounded protuberance found on cutting edge of incisors. This is common in milk teeth or non-permanent teeth. Okay? Pero if this is seen in permanent teeth, yun, di na yun normal. Okay? So, we're done with children. Let's go with elderly. Oral mucosa may be drier due to decreased salivary gland activity. Decreased salivation may occur due to some medications being taken. Okay? Such as diuretics, antihypertensives, and even antihistamines. No? So there is the extreme dryness may also be associated with dehydration. Some receding of gums may occur, giving the appearance of increased toothiness. Okay? There is also diminished taste sensation due to atrophy of taste buds. Ang unang nawawala ay ang loss of taste of sweet and salty. Kaya, parang matabang lagi yung panlasa ng matatanda. No? This suggests diminished function of cranial nerve 5 and 7, which subserves the tongue. Okay? Also, there are tiny purplish or black swollen areas or varicosities under the tongue. Okay? These are called caviar spots. Common in elderly. Teeth may show signs of staining, erosion, chipping, abrasions due to loss of density. And of course, teeth loss. No? Yan. It's very common in elderly as well. But, of course, it's preventable with good dental hygiene. Okay? They also have slightly sluggish gag reflex. What is gag reflex? The reflex, no, at your pharynx, no, that when you try to poke the upper pharynx, even the soft palate, it will close. No, that's the gag reflex. So those in long-term care facilities often have dentures in need of repair. This is due to difficulty of access to dental care in these situations. Okay? Alam nyo ba, it's also common in elderly who wear dentures that they swallow the denture. Okay? That's also common. In some patients, in some patients, pag nawawala yung dentures nila, no? Bigla na lang, kunwari. Siyempre, patients who are elderly, meron na rin silang sort of dementia, no? So, makakalimutin na sila. Minsan, hindi nila napapansin na lunok pala nila yung dentures nila. In some patients, mas malala pa, no? The denture went to the trachea, no? Bigla na lang, there is difficulty of breathing. So that can cause them death. Okay? That's why dapat tamang-tama or perfect yung fit ng dentures ng elderly. Okay? So if you see an elderly patient in the future with poor dentures, no, that easily falls off, you have to refer them to dentists as well. Okay? So that's it for our discussion for the mouth. Let's go with the neck. So here, this is the muscles of the neck, no, are shown here. The main landmark for the neck is your sternocleidomastoid muscle. So what happens here, the function is, if you say, for example, look to the right sternocleidomastoid will contract. If you look to the left sternocleidomastoid will contract as well. Aside from the sternocleidomastoid causing most neck movements, no, below the sternocleidomastoid, you will also find important vessels such as your carotid artery and your jugular vein. Okay, so another important muscle is your trapezius, the triangular muscle at the back of your neck. No, so that causes that causes your head or your neck to look upward. Okay. So on the other view, no, other important landmarks of the neck aside from the sternocleidomastoid is your hyoid bone. Okay, and of course your thyroid cartilage, cricoid cartilage, wherein below the cricoid cartilage is your thyroid gland. Okay, so this is the neck tube, providing continuity from head to trunk. Basically, the neck connects your head to your body. Okay, extends anteriorly from lower border of the mandible to upper surface of the manubrium of the sternum. Extends posteriorly from superior nuchal line of the occipital bone to the intervertebral disc between C7 and T1 vertebrae. So, the neck is from C7 to T1. Okay. So the neck has 4 compartments. So first is your anterior or visceral compartment. Yan. So ito yung anterior compartment natin. No? So in the anterior compartment, what you will see are parts of the digestive and respiratory tract. You have your esophagus. You have your trachea, right? For the posterior, you have your vertebra, have your spinal cord, some cranial nerves, and of course the muscles of the vertebral column. For the lateral or vascular compartment, this is where you will find your major blood vessels. Again, the carotid artery and the jugular vein. The carotid artery supplies blood to your brain, okay, and to the head. Also, this is where you will find your vagus nerve, the cranial nerve 10. Okay. So, the root of the neck, area immediately superior to the superior thoracic aperture and axillary inlet. Superior margins of clavicle, this is the clavicle, anteriorly, and of course the scapula posteriorly. The scapula is at the back. Let's go with the lymph nodes, which are found in the neck. Okay, so we have different levels of lymph nodes. The function of the lymph nodes in the neck is that they drain the lymphatic fluid from the head, brain, and the face. No? So level 1, you have submental and submandibular lymph node. Submental, submandibular. Submental is 1A, submandibular is 1B. Level Level 2 is your upper jugular. Level 3, middle jugular. Level 4, lower jugular. Okay, again, 1A submental, 1B submandibular, 2 upper jugular, 3 middle jugular, 4 lower jugular. 5A, 5B, this is your posterior triangle, posterior to your sternocleidomastoid. Anterior to your sternocleidomastoid is your level 6 or anterior triangle. And lastly, level 7 is superior mediastinal. Okay? So, what's the function of the lymph nodes? No? Normally, lymph nodes are not palpable. Okay? In some patients, you can palpate small lymph nodes. No? That's normal. But they should not be tender. No? And they should be movable. They should be round. Okay? But if the lymph nodes become tender and enlarged, then that could mean infection. Okay? Because ano ba function ng lymph nodes? In the lymph nodes, that's where you will find your lymphocytes, right? That kill viruses and bacteria. Okay, so if you have any inflammation, say for example, you have tonsillitis, okay, infection of the tonsils. Okay, so the drainage of the infection, no, will be down your cervical lymph nodes. Okay. Whereas if the lymph nodes are palpable but not tender, okay, but they are firm, not movable, no, that's also abnormal. That can actually be due to other diseases such as cancer. Okay. So again, other landmarks of the neck, you have your thyroid notch, cricoid, and of course below the cricoid is your thyroid gland. Mas prominent ang thyroid cartilage ng lalaki kaysa sa babae. Okay? Ayan. Thyroid cartilage, cricoid, and then below the cricoid is your thyroid gland. Ayan, again, thyroid cartilage, cricoid cartilage, and then your thyroid gland. Okay? Finding the thyroid gland. Left and right lobes are at the anterior triangle in the lower neck at either side of the airway, inferior to the position of the oblique line of the thyroid cartilage. The sternothyroid muscle, okay, prevent lobes from moving to the upper neck. Locate the thyroid prominence first, okay, the thyroid cartilage, kapain mo muna yan, and then go down and find the cricoid cartilage. Okay. So what's the function of the thyroid gland? Regulates metabolic activity through your thyroid hormones, the thyroxine and triiodothyronine. You also have parafollicular cells in the thyroid gland which produce calcitonin. So the function of calcitonin, which is a hormone, it lowers calcium in the blood. Okay. So behind your thyroid gland is your parathyroid gland. You have 4 small parathyroid glands. No? The function naman of the parathyroid gland is that it produces parathyroid hormones, which in contrast with calcitonin is that it elevates calcium in the blood. Okay, so also when you are assessing the thyroid, no, most of the time it's not palpable. Okay, and if it is palpable, it should be small, no, usually 1 to 2 finger breadths lang, no, okay, and it moves with deglutition or it moves with swallowing. Okay, so that's it for our lecture discussion. Please read your book and Watch the videos to prepare for your return demonstration and exam.